Hello, welcome back to Informal Training Solution. That will be briefly explaining the sympathetic nervous system pharmacology. Now, this is the one that is responsible for fight and flight. Now, the neurotransmitter is epinephrine, and of course we also have dopamine. The adrenal medulla is innervated by the preganglionic sympathetic fibers, and the inner medulla is a source of catecholamines, epinephrine and epinephrine, as I said above. And the chromaffin cells in adrenal medulla synthesize and secrete norepinephrine or the epinephrine. I've already repeated it a lot so that we can get it. Now, how are catecholamines synthesized? Tyrosine is transported into the nerve endings to hydroxylated by tyrosine hydroxylase, which is inhibited by tyrosine to dopa. Now, until we reach norepinephrine. Now, there are very many steps here which I have missed out because this is a short presentation where how we synthesize norepinephrine. There are those steps I'm sure which you are aware of. It's just a small summary. Now, after synthesis, it is stored in the vesicles by the vesicular monoamine transporter or the VMT. This of course is inhibited by reserpine. Release is by action potential, which open up the calcium channels. Tyramine, amphetamines, and ephedrine are capable of releasing the transmitter from the vesicles. Now, how after release, because the time it is metabolized, the tyrosine action it is by monoamine oxidase enzyme or the catechomethyltransferase enzyme. Now, also we can have reuptake by the norepinephrine transporter. Now, the adrenoceptors, we're having all of them are G protein coupled receptors. All of them are G. That's why we have the alpha and beta. Now, this one has been explained clearly in pharmacodynamics. We have the beta 1 receptors, which are located in the heart. They stimulate the rate and force of contraction of the heart. In the juxtaglomerular cells of the kidney, which stimulate renin release. This one we shall explain better when you reach hypertension. Now, in the beta 2, receptors are located in the smooth muscles of the airways, uterine, and vesicular, where they cause relaxation. Because we know they're used mostly in asthma and COPD. Now, we also have in the liver, where they stimulate the glycogenolysis. Also have in the pancreatic beta cell, they stimulate insulin release, and of course, they're also located in the heart. Now, beta 3 has limited use, however, they are located mostly in the adipose tissue or the fat cells. Now, in the alpha 1, or the pupillary, we have the dilator muscle where they cause mydriasis, pilomotor smooth muscle where they cause the hair to how they call it, to look straight. I don't know. In the trigonal bladder muscle, they cause contraction leading to prevention of diuresis. Now, out in the alpha 2, they are located in the adrenal nerve terminals and some smooth muscle where they cause contraction, and also sometimes in the platelets where they lead to platelet aggregation. Let us look at the non-selective adrenoceptor agonist, the non-selective, which doesn't have both alpha and beta receptor effects. Now, epinephrine and dopamine. Now, epinephrine, of course, we know that in the CVS, it can increase vascular effects. Sorry, at the alpha, it can increase vascular effects in the way it can cause vasoconstriction, and in the beta 1, if in the beta 1 where that is in the heart, it can cause increased contractility, and it can decrease blood flow to motility of the organ. That's why it can cause necrosis sometimes. One of the side effects is what? Necrosis. Now, the user is using severe hypotension and anaphylactic shock, also in the cardiac resuscitation. Remember, this one it is given intracardiac. Intracardiac. The intracardiac. Now, the other one is epinephrine. Of course, it has effects, beta 1, beta 2 effects where it accelerates or reinforces the cardiac contractions and also increases the cardiac output. Now, this is cardiac output, CO. Now in the alpha, alpha 1 causes vasoconstriction in those vessels, and beta 2 vasodilation. Now to use in anaphylactic shock and cardiac arrest, of course also it administered intracardiac. Now also it is administered together with local anesthetics such as lignocaine or lidocaine due to vasoconstriction. Now when it causes vasoconstriction, it prevents the drug lidocaine from moving away from the site of administration to the general situation. Hence that local anesthesia is maintained for at least a longer period of time until tooth extraction is carried out. It can also be used to decrease production of calcium, though it's not used for this one, but can also do so. Now, adverse effects have hypertension, tachycardia, palpitation, arrhythmias, and gangrene. Because remember, it will inhibit, it will prevent blood from these other areas of the body. Let us look at the other. I won't talk about dopamine. But we shall do that. I think we shall find somewhere else. Now, the alpha agonists, these are the bind to the alpha receptors. These are the alpha 1 and alpha 2 on the vascular smooth muscle and induce contraction of vasoconstriction. We have the alpha 1 receptor agonist. This one, the alpha 1. We're having the phenylphrin or mesosamine or citemizolone. Now this drug, we are aware of it. This one, osimetazoline, is used intranasally, and zimetazolone. Of course, they activate the alpha 1 receptor and cause vasoconstriction, papillary dilator muscles, and of course the increased voiding. Now the alpha 2 selective agonists have clonidine. Now the uses, we know that oxymetazoline or xylmetazoline, they use in nasodecongestants or in ocular decongestants. Why? Because of this vasoconstriction, the increased draining of the humor, the aqueous humor. Now, clonidine is used in hypertensive condition. I'm sure you are aware of all these. I'm sure you get more information always. Now, the direct acting sympathomimetics or the beta agonists. Let's look at the beta agonists. They make the effects of the sympathetic adrenergic stimulation by acting through the beta receptors, such as the cardiac stimulation via beta 1, which is increased heart rate and contractility, and of course the beta 2 in the smooth muscle relaxants. They can act as the bronchodilators. Now, beta 1 have the butamine used in heart failure because of increased cardiac stimulation. Beta 2, these are the salbutamol, sorbitol, phenytoin. They are used in asthma and COPD. Those ones, they have those ones with beta 1 and beta 2 effects. Isoprenaline, this one is used in cardiogenic shock, and isoprotanol. These are all drugs which are used. The indirect acting sympathomimetics, they increase synthesis or release of the or decrease the uptake or decrease the metabolism. I'm sure soon I've talked about it in the synthesis. Now we have ephedrine, increases the norepinephrine release and has vasoconstrictive effects and alpha effects. Now, pseudoephedrine, of course, we know it is available in the cough, mostly the cough and flu syrups in the pharmacies. Amphetamine is a drug of abuse. It is increased the release of norepinephrine, methylphenidate, which is of course there are other examples of amphetamine like methamphetamine. Now, methylphenidate, which is almost related to amphetamine, used in children with attention deficit hyperactivity disorder. Remember, this is a short presentation. We're having those ones which inhibit reuptake of norepinephrine, such as cocaine. It inhibits reuptake of norepinephrine. Of course, when norepinephrine stays within the synaptic cleft, when you have increased activity. Let's go to the agonist. I'm not talking about the MO, the catechol-methyl transferase inhibitors, and the CONT. Those ones you can look for in that information. Now the alpha antagonists, so we know they block the alpha receptors. We have the non-selective, they either block alpha 1 and alpha 2, and we have the reversible one, penta, phento, so it is phentolamine, and the irreversible such as phenoxybenzamine used in pheochromocytoma. I'm sure you are aware of this one in details. We are having the non-selective antagonists, they either block alpha 1 or alpha 2 receptors. We have the reversible blockers, phentolamine, and the irreversible blockers, phenoxybenzamine, used in pheochromocytoma. The selective alpha 1 antagonist selectively block alpha 1 receptors, prozosine, doxorubicin, terazosin, tamlosin, alphozocin, used in moderate hypertension and in combination with other drugs, and again they are also used in urinary retention due to benign prostatic hyperplasia or the BPH. Side effects of these ones we have postural hypertension, nasal stiffness, and failure of now the beta receptor antagonists, we have competitive. These are because they block the beta receptors. Now we have the non-selective one. We have Propranolol, Nadolol, Timolol, Pindolol. The beta 1 selective, we have acebutolol, atenolol, esmolol, metoprolol, nebivolol. Sure you are aware of all these examples. I'm a bit very fast such that the presentation is not long. However, we have also the labetalol and carvedilol. These ones have combined alpha and beta blocking action. Now they're used in hypertension, angina, heart failure, thyroid storm. When we reach thyroid gland in endocrine pharmacology, we shall talk about use of propranolol in thyroid storm, and then can also be used to manage migraine, and some people who have stage anxiety, they can use these drugs, but mostly in hypertension and angina, cardiac failure, all this one. Now the side effects of non-selective beta blockers, non-selective bronchoconstriction, arrhythmias, bradycardia, hypotension, disturbances in the metabolism, such and they mimic the hypoglycemic effects, and they are not administered with diabetic medications. I'm sure you're aware of this. This is very important to know. They cause disturbance in the metabolism and mimic hypoglycemic effects. They are not administered with anti-diabetic med drugs, and they are contradicted in asthmatic patients. Why? Because they cause bronchoconstriction. So this has been a short presentation on sympathetic nervous system pharmacology. Always contact us for more information. We also have the sympathetic presentation. You can search for it. It will end with anyway, I changed this one. Now always remain Wilson from M Pharma Training Solutions. You can always contact us for more information. Shall always help via email or WhatsApp. In case you haven't subscribed to the channel, subscribe to our channel, like all our videos, leave a comment. Thank you very much and stay safe.